Nurses at the Mahikeng provincial government hospital are waiting for their COVID-19 test results to come back. They were tested after a doctor tested positive for the virus. Let's track that story with our reporter, Pule Letswiti. Pule, tell us more about what's happening with those results.
Well, good morning, Jane. And what's definitely happening, as you said, that some of these nurses are expected to be receiving their results after going into tests just last week. And we do know that just again what happened is that doctors had down tools after saying that operations at the hospital, at the Mahikeng provincial hospital, should be halted and everyone be tested. But we were told that what's happening now is that doctors have come in and they are beginning to work. But to give us more clarity about that, I'm joined by the acting CEO here at the hospital, Dr. Bele. Thank you very much for joining us this morning. If you can just clarify and give us a bit of detail as to what is the way forward after what happened just last week.
Yeah, good morning. Where we are now is that we have managed to decontaminate the 3 areas that were affected, with our theatre, our maternity ward and our gynae ward, and this task was done by Saturday. And today we are now engaging in a process of now calling in all the 100-odd workers who were tested, who were all claimed to be primary contacts. So today they are going to receive their results as individuals. We do not want to infringe on their rights to confidentiality and so forth. So we are basically meeting to say how is the process going to unfold. We expect to be done around 1 o'clock if all of them avail themselves for their results. And then thereafter, depending on what the results look like, because I don't know what they look like, the clinicians will tell us, and then we'll handle each case according to what the outcomes are. That's where we are now.
Doc, particularly in regards to that matter, unions have raised concerns in terms of the way and the swift action that was taken by the Mahikeng Provincial Hospital to say it was delayed, and they therefore also say that the lives of workers who are on the front line are at high risk danger. Could you please tell us more about this, as well as to what are some of the measures that you've put in place to protect workers here at the hospital?
This hospital, in fact, it's one of the first hospitals, as far as I know. We started around the 6th of February preparing for COVID, when there was a case in Botswana. That's when we started with trainings, manual. When on the 16th, that Monday, meaning of March, when we had a disaster having been declared, Disaster Management Act, we had 2 or so more meetings, including the province. Northwest had been up there. So we had been training staff. We have trained more than 1,100 workers on use of PPE, on COVID. We have such statistics. We have been training them. So attendance registers are there. And in terms of availing PPE, we have PPE. I mean, as I speak, as of yesterday, we had about 3,400, around there, 3,400 surgical masks, more than 50 liters of sanitizer, more than 60 boxes of 35 and 95 masks. So we've been doing well. In fact, when it comes to screening, as far back as 2 weeks ago, we were at 15,500 people screened in this hospital at the gate. And in fact, also inside, we also screen our staff members. So screening is a bit, but I like it because we have statistics and proof, so I'm not worried. So in terms of protecting workers, we are doing that, and we've been doing that daily. Here we have meetings Monday to Monday. So it is not true that we are not taking workers' lives seriously. I think the issue of this case was more about interpretation and so forth. And I will wait and see what the results say, whether we'll be vindicated or not. But that's not about being vindicated. The truth is that this disease is serious, and we're taking it very seriously as management.
Well, thank you very much for joining us, Doctor, this morning.
Thank you.
All right, there we go, Jane. And as they have confirmed, the acting CEO here at the hospital saying also that the morale is quite standard by the doctors here. But of course, we're getting a different message from the unions who are saying that this is one of the reasons why nurses down tools last week, because they were quite concerned about their lives being at risk here. But I'm just going to ask my colleague, to pan on my far right hand side, and that's where you can actually see where meetings are currently taking place. This is where they actually strategize and talk in the morning as to what is the way forward. Health workers at the front line actually looking at how they're going to try and curb the spread of the deadly coronavirus. We are told these meetings take place every week, and as much as they can meet to try and actually put plans in place as to how people can be saved when coming here. We do know that the doctor who's tested positive for COVID-19 has since been put in self-isolation, and of course those nurses and doctors as well who were tested have now also been told to stay home until they receive their tests.
Live in Mahikeng. Thank you.